Bismillahirrahmanirrahim. Today our tutorial is all about Paget disease of the bone. Paget disease osteitis deformans is a chronic skeletal disorder which is characterized by the abnormal and excessive remodeling of the bone. The disease was named after Sir James Paget, who described the condition in 1877. Paget is the second most common bone disorder that affects elderly person in the United States after osteoporosis. Studies shows that the paramyxovirus is the causative agent, and the epidemiology, it has a predilection for men over 40 years living in Europe, North America, New Zealand, Australia, and UK. Anatomic distribution of Paget disease usually is asymmetric and most commonly affect the lumbar spine, pelvis, sacrum, femur, and the cranium. Less frequently, however, cervical and thoracic involvement can be observed. In Paget's disease, the polystotic involvement is more frequent than the monostotic involvement. Polystotic involvement means more than one bone involvement occur in the Paget disease. This disease is initiated by overactive osteoclastic bone resorption, which is compensated by the osteoblastic activity, which result in a disorganized mosaic of woven and lamellar bone formation. The primary event in the Paget disease is intense focal resorption, which is followed by the disorderly bone formation that results in overall abnormal bone remodeling. Paget's disease is generally considered a relentlessly progressive disorder that evolves through various stages or phases of activity. Three phases are recognized in the Paget disease, or the osteolytic phase, mixed phase, and the sclerotic phase, which is also known as the blastic phase. In the osteolytic phase, in which the osteoclastic activity predominates, which aggressively demineralizes the bone. Mixed phase is the active phase in which there is both osteoclastic and osteoblastic hyperplasia, rapid disorganized proliferation of new bone tissue by the osteoclast. In the sclerotic phase, there is osteoblastic bone formation, new bone formation which exceed the resorption. We diagnose Paget disease with the clinical picture and certain investigation. However, radiography remains the most inexpensive method to evaluate patients with the Paget disease of the bone. CT, bone scintigraphy, or the bone scan and MRI have a complementary roles in achieving the correct diagnosis of the Paget disease and then its complication. The features in the plain radiograph will depend upon the phase of the disease, whether it is osteolytic or mixed or the sclerotic. I will show you certain x-rays. This is the image lateral view of skull and is known as the caudal wool appearance. There is both a lytic as well as sclerotic appearance, and there is a diploic winding. Both inner and outer calvarial table are involved. This image is known as the Tam O'Shanter sign, a Scottish hat appearance of the skull faring over the facial bone. This is the mosaic pattern or the jigsaw pattern of the bone. In this image, there is a well-defined osteolytic lesion. It is known as the osteoporosis circumscripta. This is the image of spine, which is known as picture frame vertebra or picture frame sign. In this image, you will appreciate the cortical thickening and sclerosing is occurring. In this image, you can see a small cortical break, and this is known as the banana sign. In this image, you can appreciate that in the femur, which begins as the subchondral area of lucency with advancing tip of V-shaped osteolysis that extending toward the diaphysis is known as the blade of the grass or candle flame sign. We know that in the mixed phase there is a osteoclastic and osteoblastic hyperplasia, and this is the frontal radiograph of the pelvis. There is a coarse trabeculation and bone sclerosis, and there is a thickening of the of iliopectineal and ilioischial line on the right side of the pelvis. This is the bone scan or bone scintigraphy which accurately marks site of the disease, and this is the bone scan image of Paget affected patient. The Lincoln sign, also known as the black beard sign, is one of the signs of the Paget disease which is seen on the bone scintigraphy when the disease involves the mandible. The MRI may also show lumbar spinal stenosis, and the CT scan show cortical thickening and coarsened trabecule. Many complications occur in the Paget disease: increased risk of the osteoarthritis, pathological fracture, nephrolithiasis, and the less common but can occur the congestive cardiac failure, myelopathy or radiculopathy, cranial nerve palsy, and due to involvement of vestibulocochlear nerve, there is a conductive hearing loss. And there is also secondary development of the tumor, osteosarcoma, which shows cortical bone destruction and soft tissue mass. This is the image of the lower limb bone, and you can well appreciate the normal versus Paget disease involved bone. In the Paget disease, there is a bone angulation which leads to the reduced mobility of the joint, secondary osteoarthritis that leads to the crippling. This is the image known as the lianthiasis ossea or the lion-like face, which occur in the Paget disease, and it takes many decades. There is a hyperostosis of the mandible facial bone, which also involves the cranium. And how to treat the Paget's? First of all, medical treatment is given bisphonate, and the rest is the surgery is indicated. Thank you.